Understanding our bodies is one of the most important things we can do for our overall health and well-being. And when it comes to family planning, whether you're hoping to start a family or prevent pregnancy naturally, knowing your body's natural rhythms is key. That's why today we're taking a deep dive into ovulation and fertility windows. We're going to break down these complex processes into simple terms, empowering you with the knowledge to make informed decisions about your reproductive health. Let's start with the basics. Ovulation is the monthly process where your ovary releases a mature egg ready for fertilization. Think of it like a tiny biological miracle happening inside your body. This usually occurs around the midpoint of your menstrual cycle, roughly 12 to 16 days before your next period starts. Now, every woman is different, and your cycle length might be slightly shorter or longer. But the key takeaway is that ovulation is a pivotal event in your reproductive journey. Now, let's talk about the fertility window. This is the time during your cycle when you're most likely to conceive if you have intercourse. It lasts about 6 days, encompassing the 5 days leading up to ovulation and the day of ovulation itself. This is because sperm can actually survive inside the female reproductive tract for up to 5 days, patiently waiting for the egg to be released. So even if you don't have intercourse on the exact day of ovulation, having it within this window significantly increases your chances of getting pregnant. So how do you know when you're ovulating? Well, there are several methods you can use. One way is to track your menstrual cycle. If you have a regular 28-day cycle, ovulation typically happens around day 14. However, many women have cycles that are shorter or longer than 28 days. This is where things get a little more personalized. You can pay close attention to your body's signals. Some women experience ovulation symptoms like mild pelvic pain, changes in cervical mucus. It becomes more slippery and stretchy, like egg whites, and a slight increase in basal body temperature. Now, you might be wondering, why is all of this important? Well, understanding your ovulation and fertile window is crucial for family planning. If you're trying to conceive, timing intercourse during your fertile window is key to increasing your chances of getting pregnant. On the other hand, if you're trying to prevent pregnancy, understanding your fertile window allows you to avoid unprotected intercourse during that time, reducing the likelihood of conception. It's all about empowering yourself with knowledge. It's important to note that several factors can influence ovulation and fertility. Having regular cycles makes it easier to predict ovulation, but irregular cycles can make it more challenging to pinpoint the fertile window. Age is another factor, as fertility naturally declines as women get older, particularly after the age of 35. Certain medical conditions like polycystic ovary syndrome, PCOS, or thyroid disorders can also impact ovulation. If you have concerns about your cycle or fertility, it's always best to consult with your healthcare provider. They can help determine if there are any underlying issues and guide you toward the best course of action. If you've been trying to conceive for a year without success, or for 6 months if you're over 35, it's definitely time to seek professional guidance. Thankfully, we live in a time where technology can lend a helping hand. Over-the-counter ovulation predictor kits, OPKs, can detect the surge in luteinizing hormone, LH, that happens right before ovulation. This surge signals that ovulation is likely to occur within the next 24 to 36 hours. Another helpful tool is tracking your basal body temperature, BBT. By taking your temperature every morning before getting out of bed, you can detect a slight increase in temperature, which indicates that ovulation has occurred. And there you have it. We've covered a lot of ground today, but the key takeaway is this. Understanding your body's natural rhythms, particularly ovulation and your fertile window, is incredibly empowering. Whether you're trying to start or grow your family, or if you're looking to prevent pregnancy naturally, this knowledge puts you in the driver's seat of your reproductive health. Remember, knowledge is power, and when it comes to our bodies, there's no such thing as too much information.